We're going live soon. Everybody get ready.
It's News Channel 376 with your lead anchor, Carrie Cottle. And with traffic, Tara Carpenter. And with your weather as always, Jenna J.
Good morning. I'm Carrie Cottle, and this morning we turn our attention to a common yet often overlooked condition affecting millions worldwide: diverticular disease. This condition comes in two forms: diverticulosis and diverticulitis. In diverticulosis, the walls of the bowel develop weakened spots that balloon out into small pouches known as diverticula, most commonly found in the sigmoid and descending colon. Though often silent, these pouches can trap intestinal contents, sometimes leading to blockage or infection, and that's when diverticulosis turns into diverticulitis. Diverticulosis is largely asymptomatic, affecting up to 85% of patients without causing symptoms. It's strongly associated with aging. Less than 5% of individuals under 40 are affected, but that number skyrockets to over 65% by age 85. Of those with diverticulosis, 15 to 20% may go on to develop diverticulitis. And a further 15 to 25% of those may face severe complications like abscesses, ruptures, and peritonitis, possibly requiring surgery. Even without surgery, recurrence occurs in 20 to 35% of cases. The disease impacts both men and women equally, typically resurfacing around age 60. What causes it? The culprits: weakness in the bowel wall and increased pressure inside the colon. The leading risk factor? A low-fiber diet, a hallmark of Western lifestyles, along with obesity and even genetic predisposition. Pathophysiologically, these weak spots often form where blood vessels enter the bowel wall, a vulnerable point for herniation when abdominal pressure rises. If the bowel doesn't drain properly, materials can accumulate, leading to inflammation and infection. In chronic cases, this can cause scarring and narrowing of the bowel, further complicating digestion. So, as our population ages and fiber remains missing from many diets, diverticular disease is a condition more of us may encounter, making awareness, prevention, and early treatment all the more critical. Now, over to Jenna for the clinical manifestations of diverticular disease.
Good morning, everyone. I'm Jenna Jerkwitz, and I've got your clinical conditions forecast, and today we're tracking a turbulent front moving across the abdominal region called diverticular disease. Let's zoom in on the left lower quadrant where things are looking stormy. Patients often report dull, episodic, or even steady pain here, and depending on the severity, that pain can shift toward the mid-abdomen or even mimic other storms like peptic ulcers or pancreatitis, especially if it involves the transverse colon. In more acute conditions, we're seeing a surge of symptoms: sharp lower abdominal pain, often accompanied by fever and tachycardia, the body's own warning sirens going off. These are telltale signs of diverticulitis moving in. Meanwhile, bowel patterns are all over the map. You might experience constipation, diarrhea, bloating, increased flatulence, and even anorexia. It's a full gastrointestinal pressure system sweeping through. On the radar, many patients with diverticulosis might not show any clinical signs at all. Clear skies on the surface. But if diverticulitis develops, we're tracking classic lower left quadrant tenderness, nausea, and even traces of occult blood in the stool. And here's a surprise development. If diverticular disease strikes on the right side, symptoms can mimic appendicitis, with right lower quadrant tenderness, throwing off the diagnostic GPS. So, be alert. This system is tricky and unpredictable. For diagnosis, we're bringing in the big equipment. Abdominal x-rays, ultrasound, MRI, and importantly, the CT scan, which is the gold standard to spot those inflamed outpouchings. But take note, colonoscopy is a no-go during active storms. That is, during acute diverticulitis. For our female viewers, a pelvic exam and a pregnancy test are part of the diagnostic package, making sure the source of the pain isn't coming from elsewhere. And let's not forget those labs, a complete blood count, electrolytes, liver enzymes, and even stool studies if diarrhea is a part of the mix. Approximately 20% of patients with an initial episode of diverticulitis experience at least one reoccurrence. So once the storm system moves in, it often comes back. Cutting red meat and increasing fiber, as well as regular exercise and smoking cessation, are strong preventative strategies. You no longer need to avoid nuts or popcorn. So what's the takeaway from today's clinical climate? Don't ignore the warning signs. Pain patterns, fevers, and digestive irregularities could mean a diverticular disturbance is brewing. I'm Jenna, and that's your Gut Weather Report, helping you stay ahead of the front line of inflammation. Back to you in the studio.
Thank you, Jenna, for that great insight. Now, let's head over to Tara to learn about the impact that diverticular disease can have on the body.
Hi, good morning. I'm Tara. I'm bringing you the latest health updates. So far, we've got some major slowdowns on the internal highways today due to a growing issue known as diverticulitis or diverticular disease. First, let's start up in the GI corridor, where we're seeing a structural weakening along the walls of the colon, particularly the sigmoid and descending lanes. These weakened areas have formed little side street outpouchings called diverticula, and they're clogging up the traffic flow in a very big way. Normally, things cruise along smoothly through the digestive freeway, but when these diverticula collect debris, otherwise known as intestinal contents, we're seeing a buildup that leads to congestion and obstruction in the colon. That's like a jackknife semi on an intestinal expressway. When inflammation sets, these pouches become hotspots for trouble, escalating the situation to diverticulitis. And now not only is the traffic slowed, but we've got hazmat crews on the scene, otherwise known as the immune system, responding to potential infection. This inflammation can cause spillover effects, impacting multiple systems from the digestive system, circulatory system, and the abdominal cavity. With the digestive system, obviously it's going to be jammed up, and you're going to have to find alternative ways to get unjammed. The circulatory system also might ramp up too, responding with fever, elevated heart rate, and potential bleeding from the affected areas. And in extreme cases, if a rupture does happen, peritonitis can flood the abdominal cavity, turning a localized problem into a system-wide emergency. Remember, it isn't just a local slowdown. It's chronic inflammation over time that can reroute traffic permanently by causing scarring and narrowing of the bowel, which leads to long-term detours in digestion and nutrient absorption. So if you're feeling backed up, bloated, or dealing with mysterious pain, it might not be a routine slowdown. It could be diverticular disease, backing up your intestinal interstate system. That's the scoop from the Health Traffic Desk. I'm Tara, keeping your biological boulevards moving clear. Drive safe out there and add some fiber to your route. Back to you, studio.
And now, In today's health focus, we are zeroing in on the head-to-toe assessment techniques that healthcare providers use to care for patients with diverticular disease, a condition that may be silent at first, but can quickly take a serious turn. Let's break it down from top to bottom. A neurological assessment. While not a direct target, assess the patient's mental status for any signs of confusion, especially in older adults. Systemic infection or pain can sometimes alter cognition, and it's important to note any changes. A cardiovascular assessment. Monitor heart rate and blood pressure closely. An elevated heart rate may signal fever, pain, or a systemic response to infection. All are key flags in diverticulitis. A respiratory assessment. While not the primary system involved, severe abdominal pain can lead to shallow breathing. Also, if sepsis is suspected, respiratory rate becomes critical to monitor for early signs of systemic involvement. A skin assessment. Check for signs of fever, sweating, and pallor. These could indicate infection or systemic inflammation. In more severe cases, you may also see signs of dehydration. Gastrointestinal assessment. This is the star of the show. This is where you'll focus heavily. Inspect for abdominal distension. Auscultate for bowel sounds, which may be hypoactive or absent during inflammation. Palpate the abdomen, especially the left lower quadrant, where tenderness, rigidity, or guarding could indicate active diverticulitis or even peritonitis. Ask about bowel habits, such as constipation, diarrhea, gas, anorexia, and if they've seen any presence of blood in the stool. These are all critical signs. Also do a genitourinary assessment. Monitor urinary output, as decreased output could signal dehydration or systemic infection. In female patients, it's also important to rule out gynecological sources of abdominal pain with a pelvic exam. A musculoskeletal assessment. Pain may cause limited mobility. Patients may also exhibit guarding behaviors or assume certain positions to alleviate discomfort. You may also want to monitor labs and do a diagnostic follow-up. Some of the labs will include a CBC with differential to look for elevated white blood cells. You will also want to monitor their electrolytes and also monitor their liver function panel. It may also be necessary to do a CT scan. And these are all gold standard for diagnosis of this disease. And in conclusion, diverticular disease can range from a silent condition to a full-blown abdominal emergency. That's why a thorough, focused head-to-toe assessment is crucial, not just to monitor for complications, but to guide interventions that may save lives. As with any health condition, early detection, proper nutrition, and regular follow-ups can make all the difference. For News Channel 376, I'm Carrie Cottle, reminding you that when it comes to your health, paying attention to the little signs can help prevent the big storms. Stay informed, stay well, and we'll see you next time.
Thanks for tuning in this morning to News Channel 376.
And we're clear.